All right. Let's start with the schedule challenge. Braden, you're first. You're the next day. What did the acorn say when it was all grown up? Geometry.
Wow. Wow.
All right, who wants Braden's ride along?
We're still figuring it out.
Did you hear the joke about Helen Keller? No, she didn't. Wow, I just like take the freaking lightning right out of me. Yeah.
Why is it 2 months so strong?
What? Oh. That's a good one. That's good. Good physiology. Yep. All right, environmental emergencies. We're learning about lightning. Lightning happens when a warm front and a cold front lie very close together and are attracted to each other. It's true. When they come together, sparks happen. That's so people that are struck by lightning, your highest percentage are boaters, swimmers, golfers, anyone in a large open area or takes cover under a tree. Remember, it's a positive looking for a ground. So that's a large ground, you probably want to stay away from. So cardiac arrest is common. And actually, lightning is the only time in an MCI we start CPR because you actually have a good chance of getting them back to defibrillate. So they're usually in. Is there a bug on it? Or am I having trouble? Did you see it?
It's the bath salts.
The store said they were okay. All right, so 3 different categories of lightning injuries. There's the mild ones, which are usually indirect hits. Causes loss of consciousness, amnesia, tingling. Moderate, which causes you to have seizures and burns and respiratory arrest, kills you. And then the third one is completely kills you. I have personally experienced lightning strikes very close to me. I was actually at Lake Shasta once, and I was actually asleep, lying on a towel. And the girl I was with had very, very long blonde hair. And I'm not kidding. For some reason, I woke up and she feel like something's wrong. And I sat up and she was sitting there and a bolt of lightning came down. It was probably 60 yards away. And it hit a tree. And I'm not kidding. That thing looked like it was red. First of all, it was red. And it was like this wide. And it hit the tree and the whole tree exploded. And I'm not kidding. It was like in a cartoon. Her hair went straight out like I had never seen anything like it in my life. And I actually felt the lightning go through. It was an indirect hit. And it's most of we just ran. My pickup truck left everything there. Left the ice chest, the blankets, everything. Yeah, never only one time I've ever come that close to lightning. It's an impressive feeling when it goes right through your body. And that, like I said, that was a direct hit about 60 yards away. Like from here to I-Tech 19 welding shops, about how far away it was. And that tree just exploded. There was bark with blood. There were still pieces of bark on the windshield of my pickup for the tree. Any questions? Yeah, that's exactly what it was like. So it was weird. My perception of it was red. Remember boaters? Now you know how boaters die. Oh. God. We did. Any questions about lightning? Start CPR if you have to. AD. Let's go to spider bites. In pretty much every country in the world, there are underground fight clubs that train spiders in how to fight people. Just kidding. Anyway, spider bites generally aren't fatal, but they can rot your flesh off. Really affect your quality of life. Black widows found everywhere but Alaska. They're smart enough not to live there because it's too cold. They're pretty reclusive. They like to hide in wood piles and corners of dark garages and wait for you to stick in and grab that piece of wood that might be in the webbing on your hand and then crosses your flesh off. Really bad. They're generally black and ugly and have a little red violet on their back that doesn't play music. Any questions? People will tell you there's brown recluses there. There might be. They're not supposed to be here. They're not indigenous to this area. So unless they hitched a ride from somewhere else, which is always possible, in a crate or something, it's possible to be here. I can't really name it. I think it's some type of wolf spider. Looks a lot like a brown recluse and is commonly mistaken for it. Brown recluse will do the same thing as the black widow, but even worse, it'll necrose your flesh. You'll have to cut it out. Otherwise, it becomes gangrene and then gets septic. You all know what happens then. Any questions? Snake bots. So, since it's recording, I'm not going to give my actual opinion of this guy. But this is an example of some people that probably shouldn't breed. But it's a good video on what not to do.
Next, there's a real adult size. Calm one, hey? Oh, yes. Oh, that's a beautiful one. That's fine. That's more like an adult size. He's probably like 2 meters. Hey, behave yourself. That's a beautiful thing. Very sure of himself. Sure of his size and his strength and his venom power. Wants to move away and he's still watching. This is what I want to photograph. Just get him to relax. But see how he's not bad tempered like the little one? Have a look at me. Slowly move around and you can get a good look at his hood. Look at that hood. Beautiful. All a warning. If this snake was now faced by a mongoose, he'd probably be in trouble because a mongoose is able to wait for that strike to come low. I've been bitten, guys. I've been bitten. Snake, guys. Come here.
Everybody else think there's gonna be a different outcome here?
I like a great bandage. Real tight. Give it tight. Somebody watching that cobra?
Somebody watch the cobra. The cobra is not trying to get away from you. It doesn't go and land wait and spring people.
Hospital has you forewarned.
Doesn't hunt you
It's
down.
still a 14-minute drive away. If the venom went untreated, I could be dead in half that time.
And they're driving on the wrong side of the street.
Immediately I was alerted to the fact that a vein had been penetrated. That is your most frightening scenario, because if venom entered directly into a vein, I could be dead within 10 minutes. However, I saw that it was a cut infection, a kind of cut infection. So it sliced the vein. So in that way, the vein actually helped to flush out any venom that might have been lying around, pump it out.
See that?
And then applying suction later with a little sucking machine. So all in all, somebody's looking after me. Okay. It will never happen again. Never again. This is it. I'm getting told this.
Nevertheless, just 2 short hours later, I was back out in the field.
Wow.
Wow. Well, it's been a traumatic day. But I need all of that bandage, and I came to get a photograph, and I tend to get it. That cover's so big, it's so fantastic. I've got my camera, I'm back, and I'm gonna get this damn shot. Snakes don't move very much during the heat of the day. I knew that cobra was pretty much where I left it. Okay, I'm gonna take you to open ground to get a chance of getting a photograph.
Yeah, see that cobra, somebody need to keep an eye on it. 'Cause the cobra really wants to bite it. The cobra just wants to go home.
Okay, I'm gonna try and get an action strike as he lunges at me. That's the best I've got because he doesn't want to keep score. There we go. Okay, I've got a whole lot of shots hoping that it's just catching you more or less in. He's a dangerous boy, but he is fantastic. Making a lot of nonsense from me today. Good. Good. One more. Good.
Yeah. 40 to 50,000 a year annual in the United States, 2 main factors, alcohol and the male gender. Pretty rare, only about 15 bill a year die from it. Way higher rate of bee stings kill people. So you want to kill someone, let bees out, not snakes. There's the different types of poisonous snakes you're going to find here in the United States. Unlike what you see on television in Hollywood, they're not lying in wait to bite you. You've really got to ask for it to get bit. Most common phrase heard before someone's bit by a snake is, hold my beer. Yeah, but you got to ask for it. It's not like they're looking for you.
do, man. If you're hiking, the first person won't get bit, but the second person will.
Say, I've run across half a dozen rattlers hiking, and I've never had a problem with it. I've even seen them in trees. A lot of people didn't know rattlers could climb trees.
Sure it wasn't a king snake?
Oh,
No, I'm not.
I'm like, what?
Could have been.
King snakes like trees.
Sure looked like a rattler. Got a diamond back. King snakes are red and black. Aren't they?
They could be like tan or black. They look like a rattler.
Red on yellow will kill a fellow.
All the rest.
Yep.
Red and black, red and black,
What's that?
red and black, red and black.
Very good. I couldn't think of the rest of it. Thank you. Measure red and yellow kill a fellow. Pit vipers. Any questions? So what do we do? Used to have this whole protocol where we constricting bands on and we have suction devices that suck the venom out. Now we just limp the bite area, keep the level of the heart transport. But none of that stuff does it. Doesn't make any difference. Any questions? Get to a place that's got anti-venom. So up until about 7 or 8 years ago, guess where the largest store of anti-venom in the United States was? It's not a joke, it's real. Well, Mexico's not in the United States, so that would be
New
disqualified.
Mexico, I said.
Oh, no, not in New Mexico. It was at a place called Fairchild Medical Center in Wairika.
Shut up. That's random.
The snake, no, it's not. The snake bite count for drunk people trying to catch snakes in Wairika is unbelievable. Jethro, look at this thing. Don't apply ice. Don't try to cut it and suck out the venom. Just splint it. Keep it the level of the heart and transport. Do not bring the snake to the hospital if the snake is still alive.
But if it's dead, it's okay to take it.
Yeah, apparently.
That's gotta be fun.
I mean, it's not like it's gonna-
By the way, I have this for you.
Well, if you have a fishing line, then you can clip it to the back of a nurse's scrubs that chases her around the ER. Really? Heard they taste like chicken.
That is a cool fact.
Otherwise, you can ever see.
All right, then. Good to know for survival. When the apocalypse happens, I'm gonna remember that. There it is. Red on yellow kill a fellow, red on black venom will whack. Any questions about coral snakes? Flush the area. If you get bit by a coral snake, don't apply ice splint and transport.
Where do you find coral snakes, like Florida?
Usually I like Great Barrier Reef, area where there's like lots of coral when you're scuba diving or snorkeling. You look like you don't believe me.
I don't.
I have no idea where you find coral snakes. It's just there's a lot of coral and reefs when you're snorkeling. It's just made sense to find coral snakes.
I mean,
I thought it was
paper,
good.
it sounds great.
It was a good educated guess.
Is it Florida?
Oh, it's a big thing. Yeah.
That's good. Until I came to COS, I thought a water moccasin was a waterproof Indian shoe. I found out they were poisonous snake
They are.
in the swamp, bayou,
Yeah, they got them in like East Texas and stuff.
bayou. Any questions about coral snakes? All right, scorpions. There's scorpions here, but they're not nearly as bad as ones in New Mexico, which can be deadly. People react, have deadly reactions to the ones down in this far southwest. Any questions?
Yeah,
You're pretty small up there, right?
Yeah, they're really small. I've seen them in Dunsmere before. There's quite a few of them.
Yeah, my parents are small.
I put my house under every rock outside.
You can find a scorpion.
But they're like, they're so
They're
small.
little. Still sting if you step on their bare foot though.
They like to crawl into shoes in the basement.
Oh, lovely,
You gotta check the fingers.
lovely. That's why I don't live in Trinity Center. Right, you're Coffee Creek though, aren't you?
No, I'm south.
South of Trinity Center. Any questions? Tick bites.
So gross.
That's how you spread disease. Rocky Mountain spotted fever, Lyme disease, but no other citrus diseases. Only Lyme.
Not lemon or grapefruit.
Nope. Any questions? Takes about 7 to 10 days for Rocky Mountain spotted fever to incubate. Those are your signs and symptoms. Yeah. Bad stuff. Any questions about Lyme disease?
Excuse me.
What? Wah, 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 wah. Wah, 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 wah. Features. So don't try to suffocate or burn the tick, it'll just burrow deeper into the patient. Pull it out with fine tweezers. Save the tick for identification.
Right. Don't bring snakes, but bring ticks with you.
Make sure the tick's dead. What's that?
They have these things called tick pullers.
Yeah, I know.
Uh-huh.
Yeah, and you just like spin them right out.
That's cool.
Yeah, you don't have to pull 'em.
Get those at the camping stores like REI and stuff.
Yeah.
Yeah, I got them at that store for my dogs. A lot easier. They don't lose the head.
Good to have. Any questions? All right, injuries from marine animals. We don't get a lot of these here.
I would think that.
Worst marine animal injury we get here is crawdads. Vicious crawdads. Any questions? I can tell you the things that don't work that are legends. Urinating on the site will not do anything. Oh, that's here. My watch is dead. Same thing with vinegar. Vinegar doesn't help either. Those are all wives' tales. Lifeguards still have the vinegar they sprayed on the jellyfish stings. Yeah. However, alcohol. Alcohol does help. Yes, so get by at least one shot of tequila for every sting. Don't write that down. Talk about isopropyl.
Too late. Yeah.
I thought it was so good on this one too.
Care for marine stings are best handled by peer pressure. Any questions? All right. Here we go. Everybody's ready for this? Time to learn about the circle of life.
Neonatal care.
Nope.
It's deliberate.
Oh.
So that's how that works.
These are so disgusting. They're so ugly.
It is Halloween. It's a bloody
They
fetus.
are.
Kill
It's
you.
like purple.
All right. So what is integrity? I always talk about integrity being a big thing in EMS. It's choosing your act, you guys are gonna start getting graded on it. So I suggest you learn what it is.
You were so
Um,
cute.
Choosing your actions based on values instead of your personal gain. That's huge.
Oh,
That's what integrity is. It's telling yourself the truth and honestly telling others the truth instead of trying to color things up. Integrity is shown in your actions, not in your words. And the biggest challenge in maintaining it is not allowing those without integrity to tear you down so that you lower your integrity to match them or to respond to them. That's the hardest part of maintaining integrity. True integrity is doing the right thing when no one's watching and doing it anyway, and not even caring or concerning if anyone noticed. Because if you have true integrity, you're going to do the right thing regardless. It doesn't matter if anybody else is watching or notices. They would not understand what integrity is. It is paramount that you have integrity in this industry. All right, so here is a video of a birth and the complications that can go with it. There's some pretty serious things going on here, so be careful.
You're doing great, honey. We're almost there. Please. Okay. I see the baby's head. Right? Wonderful. Big push. Come on, honey. Push. I'm trying. Oh. Okay, I see the baby. He's coming. Here he comes. He's coming. Here he comes. What the hell? What happened? I'm not sure. What do you mean you're not sure? You're the doctor. Okay, don't panic. He's okay. He's okay. I think. What do you mean you think you're the doctor? You quack. You tell me where my baby is. You tell me right now where my baby is. So I'll be around. Calm down. All right, calm down. Okay. Now look, everybody. Something happened. Well, his head came out. Yeah, and then what? And then he turned around and went back in. What do you mean he turned around and went back in? Can he do that? It was the weirdest thing. I could swear it was like his head came out, he looked around, didn't like what he saw, and he turned around and went back in. What the hell are you gonna do about it? He can't just stay in there, can he? Get him out! Speak on, please. Hey, got an idea. A lollipop? How can you think about food at a time like this? It is not for me, okay? Now look, maybe, just maybe, there's a chance we can coax him. Come on, baby. See, I got a lollipop for you. It's not so bad. It's not so bad. I think he's going for it. Come on, baby. Come on. Hey! He just grabbed it. He just grabbed it and went back in, little bastard. Fine. We're gonna do this the hard way. Obviously not coming out on his own. Oh, so what? You're just gonna drag him out of there? Oh, you're nuts! Are you sure? Hold on. Okay.
There you go. One healthy and happy baby girl. Congratulations. He's so little. Can I hold him? Please?
Be careful.
Hi, little guy. Hi. I think you're dead. Yeah. We just did it on our own. We started it. We went back in. I'm sorry. I'm sorry. Here we go again.
That wasn't real. All right, female reproductive system. You should be generally familiar with the anatomy of the female reproductive system.
Was.
Any questions? All right. Changes that happened prior to childbirth or during childbirth, prior to childbirth, something like that. Uterus will get smooth. Fundus in the bottom. No, never mind. It's a smooth muscular organ. I'm really running out of steam here. So it'll contain the fetus, the placenta, the fetal membranes, and the umbilical cord. And then during pregnancy, the cervix will form a mucus plug. Any questions? So the placenta is a vascular organ that attaches the uterine wall. That's how it feeds the baby, gives it oxygen, exchanges waste and carbon dioxide. That's it. And then after the baby's born, it separates the uterine wall, and it's delivered after the baby. Any questions? All right. Changes that occur. So the birth canal is the passage for the fetus. Go from the uterus through the cervix to the vagina, then out to the world. So some things to note. Mom's going to have an increased plasma volume by 50%. Heart rate's going to increase 15 to 20 beats per minute. Blood pressure is going to drop. It's going to put pressure on the inferior vena cava. And her diaphragm is going to be constantly displaced. She's a little more short of breath because she can't get a full lung expansion. Big thing is if someone's in their third trimester of pregnancy, do not lay her supine ever. It always go on the left side. When you lay on supine, the amount of water and the weight of the fetus will shut off the inferior vena cava. It'll cause, it's called supine hypotensive syndrome. It'll shut the blood pressure off completely. The blood will not be able to return to the heart. Oh yeah.
I saw it.
So it's a big one to know. Any questions? All right, so how long does a pregnancy last? 280 days. Most people think it's 9 months. It's not. It's 10 lunar months. A lunar month is full moon to full moon, 4 straight weeks. Yeah, pretty much 29 days. So if you know the date of conception, you can calculate the due date by going a year forward, subtracting 3 months, and then adding 7 days. That's how you get a due date. Any questions? All right, there's 3 stages of labor. Unlike the Shakespearean Festival in Ashland, they have the stages have pretty generic names. It's first stage, second stage, and third stage. You'll have the Shakespearean Festival. So first stage is dilation of the cervix. Second stage is when the baby is born. Stage 3 is when the placenta is delivered. Now here's something we hope you'll really like.
Labor has 3 stages. In the first stage of labor, the body prepares to give birth. There are 2 phases, early and active. Early labor can last from hours to days. First-time moms may spend more time in this phase. The cervix, or the opening to the uterus, begins to soften, efface, or thin out, and dilate or open. The cervical changes are necessary so the baby can pass through. Usually, a woman's water breaks during the first stage of labor. Contractions or tightening of the uterus becomes strong and regular. Typically, the woman will have a 30 to 70 second long contraction every 5 to 20 minutes. There may also be a stringy, bloody discharge from the vagina called bloody show. This is considered normal. Active labor occurs when the cervix starts to dilate more quickly. Contractions get stronger, last longer, and occur more often. The cervix continues to open wider to about 10 centimeters. Then pushing can start. In the second stage of labor, the child is born. A healthcare provider usually encourages the woman to push to help the baby move down the vagina. She might push for minutes or hours. Once the baby's head starts to come out, called crowning, a provider guides the rest of the baby out. Childbirth is finished when the baby is completely out of the vagina. The provider then cuts and clamps the umbilical cord, which
Clamps,
connects the
then
mom and
cuts.
baby during pregnancy.
Don't cut before you clamp.
The last stage of labor involves delivery of the placenta or afterbirth. During pregnancy, the placenta supplies food and oxygen to the fetus. Once the umbilical cord is cut, the placenta has to come out. Contractions typically begin 5 to 10 minutes after the baby's birth. During this time, the placenta detaches from the uterus. A provider may encourage the woman to push, just as she did to deliver the baby. After 5 to 30 minutes, the placenta comes completely out of the vagina. Then the process is complete.
Any questions? Questions on stage 1? Any questions on stage 2? Crowning's the big one. Check for crowning. If you see crowning, just don't transport. You prepare for immediate delivery. Get your obstetrics kit out, set up, and be prepared. If they're not crowning, then you're okay to transport. Stage 3. Stage 3, you can transport. The vagina comes, or not vagina. The placenta comes out, falls on the floor. It's no big deal. The baby comes out, falls on the floor. It's a real big deal. Any questions? Any questions? What do we have here? This is a classic.
For the day I'd never forget.
So, this guy's an obstetrician in Berkeley. He died 2 years ago. He's pretty old when he died. This film was made in 1966, year I was born. So, Berkeley PD ran the ambulance in Berkeley. And he wanted to make a video for officers because they didn't get a lot of field deliveries. And he wanted to make a video. So he and his wife was pregnant, went together with a production company and waited for her to go into labor and made this video of him being the officer and her going into labor, video the whole thing. It's an excellent video. It's almost 60 years old, but it's still it's a good video. Yes, it's pirated, so there's going to be some chops to get the YouTube codes knocked out. No YouTube codes, it's not pirated licenses. Yes. So it's just old is the reason why it's a little choppy.
The police officer for just a little more than a year. That's me in the middle. No. Officer Mike Wilson.
Check on it 240 and let you know. And if I continue. 207. 207. 207, report a suspicious auto, parked with the lights on and the barn belonging in the vicinity of Shasta, just east of Park Hill. And 550. 207. We have further information on our suspicious auto. We have no further information except the occupant may be in his cell. Follow up on that.
He does a great job of the lady. It's almost like he knows.
207. Go ahead, 207. Fifty-four Plymouth, license number, regulation union, 628. 207 out.
I'm going to have a baby. I'm going to have a baby, wow. Please. Please, you got to help us. You got to help her.
I'm going to get an ambulance. If the truth or no, I think I was more scared than she was. Then I remembered one day, a week before, after our first aid class, the instructor gave us his most important advice.
Keep calm, keep calm, keep calm, keep calm. There are no more questions, gentlemen. That's it for today's class dismissed. Thank you for your help. Hi, how's it going? Chuck, you know Jim Branch, don't you? Jim, or Bob North, Bob Fryer. I have a question. Well, North has beat one, and I have beat two, and I got to thinking, what would I do if I had to deliver a baby? Seems to me being here all day, so that's what you need, delivering more babies than most doctors. That's right, boy, just call for me and I'll be there in my trusty ambulance. But what if Pete doesn't get to us in time? What do I do then? It's the same advice as before. See, childbirth is to convey a feeling of confidence to the mother and her ability to deliver the child. What would you say was next, Pete? Get the mother to be to a hospital before she delivers. That's right. Are there any other questions? Yeah, how do you deliver a baby? I thought we'd answered your question. All right, I know you're worried about techniques and so forth, right? Okay, so you can't get her to the hospital on time. You come to your own fear, and you'll have it, of calming her, making her comfortable. You ask her to remove her underclothes. You already asked of the ambulance, and nature is about to take its course. From there on, it's mostly what you don't, not what you do. You don't interfere with a natural sequence of events. That's right. For example, you don't try to hurry the birth by pulling on the baby. It could injure the baby's neck muscles and possibly harm the mother. You mean that's all there is to do, just receive the baby? There must be something else. Yes, you support the baby and keep it clear of any weights, and hold on to it. They're slippery. How about the cutting of the cord and all the other things the doctors do? Well, first of all, you're not a doctor. And if you don't have a receiving blanket and a bassinet in your car, then I'd say your job would be to get the mother and baby to the hospital. If the mother is able to hold her baby, give it to her. For the moment, you can place it face down on the mother's stomach, face down to allow any fluids in the baby's mouth or nose to drain. Just make sure the baby can breathe and is breathing. Well, like Chuck has been trying to tell you, lacking materials and abilities, and it's mostly a case of what you don't do. If you can see a birth firsthand, overcome your fear by witnessing it. Watch an experienced person, like Pete here, receive the child, cut the cord if necessary. You'd also learn what to do with the materials you carry. But lacking that opportunity, then you simply receive the baby. Any other questions? Yeah, I've got a lot of questions. But as you said, we're not doctors. Hey, we better be going. Yeah, I gotta get going too, Chuck. I'll see you later. Remember, keep calm.
Remembering all this was a big help. I decided to put it into action.
Keep calm. Why don't you go up there and try I'm going to help? And I'll be there in a minute. 207, 207. A suspicious auto turned out to be an emergency maternity. Could you hurt the ambulance? She claims she's going to deliver any minute. We'll try 207. The Shasta just east of Park Hill, emergency maternity. 207, ambulance en route, carrying 556. The ambulance is on the way. How is she?
I'm scared. When Aunt called me to take her to the hospital, I didn't think, oh, why did I get a flat tire?
Listen, don't worry, we'll manage. How are we doing? Look, make her comfortable and keep her calm. You might take your underclothes off. I'd like to move my car and get some light from this car just in case. How is she? What's the situation?
The baby's keeping born, I think. What do we do?
You're kind of scared enough. Why don't you go around to the other side of the car and try to keep her calm? You come to your own fears and you'll have it by calming her. Now don't worry, lady. Everything is going to be all right now.
Why don't you do something? Can't you help her? Can't you give her something?
I called for an ambulance. Now it's up to nature and our little mother here. Don't interfere with a natural sequence of events. You're doing fine.
Oh, what was that?
Well, you sneezed. Please calm down, wipe her forehead. Baby's head is coming. You don't try to hurry the birth by pulling on the baby.
Relax, man. Relax.
You support the baby and keep it put out of any ways, and hold on to it. They're slippery.
Get the ambulance.
Everything is going okay.
It's a boy. It's a boy, Ann.
Just take it easy, Bob. You're doing a good job.
Okay.
Here, use this to clean the baby's mouth out. Keep at it, Bob. Keep at it. Why don't we check the cords first to see if there's still a pulse?
Don't worry, Ann.
Be careful. Don't pull on the cord. Just let the afterbirth take its course. Here is where a basin would be helpful. It helps catch any weight. Put your hand on the mother's stomach and massage it gently. That will reduce any hemorrhages. Although usually under these conditions, they seldom have such problems. Okay, that'll have to do it. Congratulations, Bob. Back to me. But the job isn't over. The court isn't done. Well, now remember, Bob, that's not your job. Let's take a look now. Jordan, will you get the maternity kit? Well, how's the new mother? And how's that new baby? Everything on shipshape? Oh, child, fine. You're gonna turn your kid. Okay, Bob, here's your chance to practice medicine. I'll show you how to cut the cord. And here's the tying tape. Now, tie a square knot there. And tie the next knot about 3 inches from the other. Now, all you have to do is cut in the center of the 2 tapes. Here. Attaboy, you're doing fine. Would you like to hold your baby? Here. Fine. All right. Now hand me the baby and get the mother's friend to come with us. We'll get them to the hospital.
Thank you, officer. It'll all be over soon.
All right, now the next operation is the placenta or the afterbirth. I've got a bag here in which to place the placenta so we can take it to the doctor. He'll examine it and can tell if all of it came out. Yeah. Good, good. All right, now, put this between your legs like a sanitary napkin. Okay, that's fine. Now let's get moving. Get your coat. Why don't you go with these officers? They'll take you to the hospital with your friend. Hey, Pete, what hospital are you going to? Albert Bay. Her husband and the doctor are waiting there. Right. How you doing? All right.
Oh, I thought everything's going to be okay.
I'm sure everything will be all right. Don't worry.
I feel like I've messed everything up.
Oh, don't you believe it? Everything's gonna be fine. Look, why don't you go over and cheer up that husband? Take a big smile, all right?
Okay.
Good. Well, there's young Dr. Norton. What are you doing here, applying for a job? I have to complete my report. I don't even have the name of the mother. So here, I got most of the information from the neighbor there, Mrs. Kate. Your wife's fine, and so's your new baby boy. Oh, Dr. Tiger, have you met Mrs. Kate? She's our next door neighbor. I hope this doesn't prevent you from being a good neighbor in the future. And tell me what happened.
Doctor, it was just terrible. I don't know what I would have done if the doctor hadn't come along.
I'm pleased to meet you. You did a fine job. Thank you. How's Mr. Grant? Both mother and child are just fine. And, I didn't do anything wrong? Well, that depends. Perhaps you and I should have a professional conference. If you would excuse us for a moment, the doctor here and I are going to confer. Do you mind if I sit in, doctor? Oh, please do. I'd like to get on with you. Now, tell me how you delivered the grandbaby, doctor. That's what worries me, doctor. I didn't do anything. I just received the baby when it was born and tried to keep the mother from breathing. Oh, you did the right thing then. You kept yourself calm by calming the mother and you let nature take its course. It's everyone's tendency to try to do more than they should, such as try to speed up the birth by pulling on the baby. When all you have to do is just let it enter your hands and hold it free from any weight. It's a pretty frightening experience the first time, wasn't it? Yes. Say, doctor, just before the baby was born, there was something that scared me for a moment. A big splash of water. Well, that sometimes happens, but it's quite normal. Yeah, the birth usually follows. What worried me most was after the baby came, I didn't know what to do. All the instruction I'd had was to keep calm and receive the baby. Just about then, Fisher arrived. Well, don't give me any credit. You did the main job. But you see, when I arrived, the baby was already delivered. So I just tried to help out. I showed him how to use the ear syringe to remove the amniotic fluid from the baby's mouth. Well, you can also use the finger to clean out the baby's mouth, but the syringe is much better. Matter of fact, it's a pretty handy item to carry in any control car. Well, that's the trouble, doctor. We don't have all of this equipment in the car. What would you carry if you were in a patrol car? Let's see. Well, number one, I'd say the ear syringe. And then for a rural area, I'd want sanitary napkins to use after the delivery. Now, all of these items can be used in other emergencies as well. But what you must know what you're doing before you use any equipment. And the thing to do if possible is to bring one to a doctor. It doesn't have to be cut. In fact, it might be best in emergencies to not cut the cord unless you've been properly trained. You're a beautiful mother.
Thank you.
Thank you too, officer. Both of you. I was sure worried. Me too. But I gotta get going. I'll see you later. Okay. Friends, you'll never forget. Yeah, my thanks. May I give you a ride home?
No, thanks. My husband will be picking me up. Besides, I want to look in on Ann and kids. By the way, I'm sorry I was so silly before. I guess I was just plain frightened. But you were terrific. Thanks.
Well, that was it. Like the doctor said, it was an experience I'd never forget. And one I wouldn't want to.
Two oh seven. 207 back in service.
207, check over bicycle at 2640 Hicks. 550 off.
Okay.
Questions? Back. Good video. Now you all know how to deliver a baby. So let's go over some things that can go wrong. That's if everything goes right. You have to be prepared for things to go wrong. Preeclampsia, which is followed by eclampsia, which is caused by toxemia. Toxemia stage 1 is preeclampsia. Mom gets headache, vision disturbances, edema, anxiety, gets really hypertensive. Gets to stage 2, which is full-blown eclampsia. It's life-threatening for mother and fetus. Mom goes into a seizure, usually dies. Very treatable, very preventable. Catch it stage 1.
What is,
Toxemia. So it's an infection. And we already went over supine hypertensive syndrome. So there's a couple of different reasons why there could be hemorrhages. There's painful third trimester bleeding, and there's painless third trimester bleeding. Either one of those can cause life-threatening for mom or for fetus. If it's in the first trimester painful bleeding, you should be considering and being concerned about ectopic pregnancies. Again, ectopic pregnancy is when the egg starts to develop outside of the uterus, usually in the fallopian tube. Any questions? Here's how ectopic pregnancies happen. It's a race. It's a 9-day journey through the fallopian tube. There is no other transit system. That's when you run into a problem. It develops too fast inside the tube. It can rupture the tube and cause life-threatening bleeding. Any questions? Six weeks after last menstrual cycle. Any questions? Signs and symptoms. Sharp one-sided abdominal pain. This ventral period, it radiates to the shoulder, tender bloated abdomen, and signs and symptoms of shock. What do? It's first trimester, not third, so we can keep them supine. Oxygen. Transport. Any questions? All right. Any questions? What's that? If the tissue is expelled from the vagina, save it for pathology. All right, toxemia. You're at a higher risk of toxemia from history of diabetes, heart disease, or kidney problems and high blood pressure. Can all cause toxemia. Remember, two stages. First stage is preeclampsia, second stage is full-blown eclampsia. Stage one's on the left, stage two's on the right. Stage two is life-threatening. Stage one is also potentially life-threatening and nothing to mess around with. Any questions about the two stages of toxemia, preeclampsia and eclampsia? Much more common now that we're in the digital age, eclampsia. Just, yeah. What do? We put them on their left side, 'cause it's generally the third trimester, which is 6 to 9 months. Oxygen. Diesel. Be prepared for a seizure. Be prepared to do CPR if there's a seizure. Any questions? All right, so painful third trimester bleeding, you need to be thinking of placenta abruptio. Painless third trimester bleeding, you should be thinking placenta previa. Both are life-threatening for mom and baby. Placenta abruptio is more common than placenta previa. It's when there's an actual premature separation of the placenta from the uterine wall. Placenta previa is when the placenta slides down over the cervix and then starts rushing blood out the vagina. Previa is painless. Abruptio is painful. All right. There's an up close version with a better explanation of placenta previa. Remember, previa, painless. Third trimester bleeding, months 7, 8, and 9. Remember, total gestation is 40 weeks. This will be the last 12. That's 13. Any questions on previa? There's 2 shot. What do? This time it's okay to elevate mom's legs, keep her warm, 100% high flow too. Safe rapid transport. Any questions? Yeah.
Why would you elevate legs?
Help her blood pressure and using gravity to keep the blood from flowing out. Hopefully create some clotting. Not likely. Her Abrupta placentia. This is gonna be painful, third trimester bleeding. 1 in 5 of all fetal deaths from abrupta placentia. Abruptio placentia, much more common than placenta previa. Toxemia is one of the most common causes of abruptio placentia. Eclampsia. Any questions? Ooh, this one's still there.
Placental abruption. Under certain abnormal conditions, bleeding can occur between the uterus and placenta. This is called a placental abruption. With an abruption, oxygen delivery is reduced. Until 25% of the placental uterine interface is affected, oxygen delivery to the baby is not significantly impaired, and the baby will be able to compensate. The signs of an abruption include bleeding, abdominal pain, hypertension or increased blood pressure, and uterine irritability. The abruption can continue to expand as the bleeding worsens. And vaginal bleeding can be seen. As the abruption continues, the surface available for oxygen transfer is reduced. And maternal blood loss can affect the mother by causing dehydration and eventually lowering her blood pressure, leading to decreased oxygen delivery to the baby. Until the abruption reaches a dangerous level, the baby can continue to compensate by increasing her heart rate. When a mother presents with a classic presentation of a placental abruption, she must be immediately assessed and a diagnosis of abruption be ruled out with an ultrasound. Without proper intervention, the blood loss can lower the mother's blood pressure, leading to decreased oxygen delivery to the baby. If the abruption is not diagnosed in a timely fashion and the baby delivered, the mother will be able to compensate by increasing her heart rate. As the abruption continues, the surface available for oxygen delivery to the baby is not significantly impaired, and the baby will be able to compensate. Until 25% of the placental uterine interface is affected, oxygen delivery to the baby is not significantly impaired, and the baby will be able to compensate. Prolonged oxygen deprivation can lead to permanent injury to the fetal organs, including the brain.
Any questions? So how do we know when we have it? Painful third trimester bleeding. Painful third trimester bleeding. Severe localized abdominal pain. Abdominal rigidity. Signs and symptoms of shock.
The whole wound concentration or just?
No, just parts of the abdomen will be localized abdominal. Yes, the entire abdomen will become rigid. I'm sorry. Yes. What do we do? 100% O2. Left lateral recumbent. Diesel. Any questions? All right, gestational diabetes is a common thing that happens. It develops only during pregnancy. Mom is not a diabetic before she's pregnant. She's not a diabetic after she's pregnant. It only happens during pregnancies. And it's treated just like any other diabetic.
So type 1 or type 2?
Type 1. Honestly, don't know. I'm gonna take a god guess, say type 1.
What's the reason why they get it?
What's that?
What's the reason why they get it?
I would say probably because the pancreas can't keep up with the amount of extra cells and fluid and stuff. Again, that's an educated guess. Hold on. It's treated more like type 2. That's the question. Now, question was as a cause. Yeah, it's they're already overweight or obese, and they had lack of physical exercise, not good exercise. So the same causes as type 2 diabetes, pre-existing hypertension.
Work with it, like, organs and stuff
Yep.
like that.
And exercise.
That's not for Americans though.
No, it's not. So how do you know when to transport? If they are crowning, we do not transport. If they're not crowning, it's okay to start transport. So we have to check for crowning. And crowning is when the baby's head's pushing. You can see outside the vagina. You can actually see it looks like a crown. Any questions? Yes.
What if they're actively, you know,
What do you mean?
or vagina opening, not feeling that way, but, you know,
Then you got time.
you still know they're right.
Depends on how far away it is, but yeah, it started moving. And then if you get to the point of crowning, you can always pull over. Anyone that's never seen crowning, just go by Burger King and ask. They always give you one. Any questions? Oh, took my video. It's my video too. Well, it's not my video. So somewhere else. If you're in a natural disaster, you're probably not going to transport it. Prepare your OB kit. Have the husband boil water. All the TV shows, boil water. All right, positioning for delivery. There's all kinds of different positions. There's hands and knees. That's the more traditional position. So we actually don't suction the baby when they come out anymore. It used to be as soon as the head came out, first thing it was bulb suction, nose and mouth. We found out kids did significantly worse when they didn't struggle to breathe. Because that struggling to breathe and getting that necessary mucus out actually develops the diaphragm, makes it stronger. Then if they get RSV or something a couple months from now, they actually do better than if they didn't struggle at birth. Does that make sense? Starts working out that diaphragm first minute of birth. Make them struggle. If they're really struggling though, you better suction them, get some ice. Little struggles, okay. So first thing you do is when they're crowning, you're gonna take your hand, your gloved hand, and you're gonna put pressure against the baby's head. Not a lot of pressure, just gentle pressure. That keeps it from being an explosive birth. You don't want to have an explosive birth of blowing tissue away from mom when it comes out. Then guide the head out. Next thing that'll pop out is the shoulder. Let that shoulder come out, and then the baby pretty much slides out after the shoulder. Head and shoulder is the toughest part. Then think Slurpee after the baby's born. Everybody likes Slurpees, right? Where do you get Slurpees? 7-Eleven. Clamp the cord at 7 and 11 inches from the baby. Cut it between the 7 and 11. What? Probably a good thing. Man, just ruined me. I hate you two. Now they took away my Philadelphia camera.
Did they really?
You gotta pay for it now.
What?
99 cents.
Junkies?
99 cents a month. That camera was originally put there so people could find their lost loved ones. And now they're charging $1 a month to find your lost loved ones. Man, try thousands. All right. Other complications. An unraptured amniotic sac. That's when the baby's delivering with the fluid sac still there. In your obstetrics kit, there's going to be a hook, and use that hook to break the sac. And you'll get a flush of water. Huh? Yes, the crochet hook of doom. Now, an umbilical cord around the baby's neck. That will be on the test, and it is called a nuchal cord. Sounds like something right out of Sesame Street. Nuchal cord. It's wrapped around twice. It's a double nuchal cord. This can't be. Oh wait, that's other curves. I get my curves confused. Yes, sir. I'm good. I'm in EMT class. How can I help you then? I'm teaching up at the college right now, but how can I help you? Is everything okay? Let me call you back and break that. Everything's good though, right? Give me about 20 minutes and I'll call you back. I know exactly where it's at. Okay. You can't, it's private, the gate's locked. So, but I'll call you back in 20 minutes. Okay, bye. All right. So, if a nuchal cord's around the neck, you gotta stick your finger in there and unwrap it from the neck. And if it's too tight, you can't do it, you got to clamp the cord and cut. That's a last ditch emergency thing. And if it's a double nuchal cord, you'll have to wrap it around the neck twice. Any questions? That was a good video of a nuchal cord too. But that's okay, because I have the video. I can show it to you later. I haven't saved that part yet. So, first thing we do is we stimulate the baby after it's born. How do we stimulate it? We want to get it to start breathing. Vigorously warm and dry it. Then we hold it up by its ankles. Spank it. Just kidding, don't do that anymore. It's been gone since the 70s. They used to do that. Now, vigorously warm the child. Then, if the child is really, really struggling, then we actually suck it says about. And be prepared to ventilate. Sometimes these kids need a little help. They only need to be ventilated for a minute. And sometimes you got to kickstart it. It's kind of like throwing the prop on the old planes with the engine going. Any questions? All right, I think it's getting close time to learn about our friend Apgar, which is not going there. Has nothing to do with clamping the cord. Oh, wait, we got to go through delivery of placenta first. Apgar, we do it 1 in 5 minutes after birth. It's kind of like a baby GCS, not GPS, GCS. Yeah. Placenta should deliver in about 30 minutes. Boy, they took all my videos down. The whole sensitivity on the internet thing's out of control. Yeah, I gotta be on the list. I know they say email me a warning, so I know I want to. No, it's like,
Send them a warning.
I told them it's educational, they don't care. It's too sensitive. I cannot control what other people say and do, but I can be the best with it.
Well, it's not a person, it's a program.
I like the answer.
Bunch of propeller heads.
Follow it up.
There are a bunch of propeller heads in their mother's basement riding propeller. Propeller hats, not propeller heads. Any questions? There's Apgar. All right, so in a perfect world, we got an Apgar of 10, 1 minute after birth, then 5 minutes after birth. If it's going to be below 7, you're probably going to have to help the baby out with some ventilation. So heart rate's first thing we check. If the baby's heart rate's over 100, they get a 2. If it's under 100, they get a 1. If they have no pulse, they get a 0. Respiratory effort, if they got a good strong cry when you stimulate them, that's a 2. They kind of go, "Argh." They get a 1. And if they're not crying at all, they get 0 or no respiratory effort. If they've got good muscle tone, they come out boxing like Rocky. They're 2. If they got a little bit, they're kind of not doing much, that's a 1. And if they're a limp, it's a 0. If when you stimulate, they cry in withdrawal, that's a 2. If they just kind of go, if they don't like it, that's a 1. They don't respond to you at all, they get a 0. And if they're completely pink, it's 2. If they got blue extremities, that's a 1. And if they're really pale and blue and look dead, they're a 0. 8 to 10 is what we're shooting for. 10 is what we're shooting for. We'll accept an 8. So we assess at 1 minute and at 5 minutes after birth. Any questions about Apgar? It's getting close to break time. Man, these 2 hours go by like that. Speak for yourself, man. Apgar is calculated at 1 minute and 5 minutes after birth. Does that give Billy Mays invitation here? So 5 different times. It's like the 800. Wait, there is more. The placenta. Act now. Do not pull on the umbilical cord to deliver the placenta. That will also be a test question. All right, we're gonna go over some complications, and then we're gonna go to be continued for Saturday morning. Or maybe Monday, or maybe Sunday. Let's see. Thursday. So anybody born before 36 weeks is considered premature. Anyone born at less than 5.5 pounds, not good. That's very sick. Respiratory distress. I don't see how an O2 tent and keeping the baby warm is a complication of childbirth, but I didn't make this slide. That's a function slide. All right, go to break. Come back. We're going to be doing some skills tonight.
Yeah, we're all-